Many people think of the doctor lifestyle as glitz and glamour. Work minimal hours, make the big bucks, rolling around in fancy sports cars. But when you're dealing face to face with people's health, their wellness, essentially their livelihood, it gets a little tough. Ever since my early 20s, my health has been a major priority for me. This is probably because I know what it's like to lose my health. I know what it's like to sit on the sidelines of life, not even be able to pay your bills. This is a major disastrous problem for so many people. The number one cause of bankruptcy is literally your health deteriorating and all the medical bills that come along with it. Now, you and I both know that your health is your number one asset, but not too many people understand this concept. I was recently working with this lady who had a gamut of symptoms. When I looked at her lab, she had cardiovascular issues, thyroid issues, gut health issues, metabolic issues. Now, when I presented this information to her, she literally broke down in tears. And she was like, wow, this is the first time somebody's shown me what I've been feeling for the past 20 years. This is the first time somebody's given me hope. And I thought to myself, well, this is really good. This is something we can help you with. We help people every day with these types of issues. She said from there, I want to talk to my husband before I get started. I thought, once again, this is really great. We want to have the significant other on board. She calls 2 days later and says, over the next couple months, we want to focus on buying our dream car. So for the time being, I want to put this off. Wow. I got off the phone with her and I literally put my head down. I had her labs right in front of me that had the exact answers that she needed in order to reverse her health conditions and get her life back. But that information wasn't enough. It wasn't enough for her to take action. Now I think to myself, what could I have said differently? What could I have done differently? How could I have helped her? Look, I like nice things just like the next guy, but with labs like hers, she's gonna be facing serious health challenges. Her quality of life will continue to decline, and she won't be enjoying her 50s, 60s, and 70s if she can even make it that long. This is one of the hardest things you'll face as a doctor. To want something more for someone than they want it themselves. I wanted to help her get better. I wanted to give her hope. I wanted to help give her years of youthful energy. I wanted to help keep her free from medication and surgery and live a long, healthy life. This is one of the difficult challenges that I run into often as a doctor. There's a large percentage of people that value material objects over their health. I see it every single day. There's a lot of people that want to have the fancy sports car, the big house, the big fancy vacation, and they value all of that and they put their health on the back burner. I see them running into serious health challenges, life-threatening diseases, but yet they don't want to invest in their health or themselves. They don't want to make the necessary changes in order to promote health and longevity. But that's the problem. Without your health, what good is the new car? What good's the fancy house? What good is this big elaborate vacation? When your health takes a dive and you're in the hospital or on medications, or maybe even worse, what good is all that? But then there's also this that happens. A new patient starts care, he's committed, he's eager to do whatever it takes to get well, or so he says, and then months and months go by and he just isn't getting the results that he should be getting. I always take this personally. The reason for it is because there's a lot of doctors out there that don't get patients well, and then in a lot of cases, they'll just blame the patient. Or from there, they'll go in and tell the patient, you know, these problems are all in your head, and this is the reason you're not getting well. There's nothing I can do to help you. This happens every day to people just like you. Now, here's the thing. I take extreme ownership for my patients. If I take on a new patient and I tell you I'm gonna get you well, I'm gonna make it happen. But when I work with individuals and they don't follow the advice, inadvertently, they are not going to get well. And it's very difficult. If at our 1 month checkup or maybe even our 2 month checkup, we do a reassessment to measure progress and there isn't any, well, then that's a red flag, because I know as a doctor that if I make changes to your nutrition, your diet, your lifestyle in general, that there will be physical and measurable changes that are going to occur. I've worked with thousands of cases, so I know beyond a shadow of a doubt, if you do what needs to be done, there'll be certain physiological and biological changes that will occur, hands down. But then there's situations like this.
So Mrs. Jones, it's really important that you stick to this anti-inflammatory autoimmune diet in order to help reverse the autoimmune issues that you're facing, okay?
Okay, I'll follow it very closely.
Thank you.
Yeah, can I get a Big Mac meal, extra cheese, extra lettuce, no condiments, a large fry, and a Diet Coke, please?
So Mrs. Jones, it's been 2 weeks since we last met. How's the diet been going?
Oh, I've been crushing it, Dr. Z. I have been super strict, and when I don't have a chance to meal plan, I'm making good choices when I go out, right? Like, making sure I get lots of good fats in, doing lots of veggies, really been doing good with it.
It's interesting because, it doesn't show that you've made much progress since the last time we met.
It's frustrating for me because I want to get this person well. I want to make changes in their life and transform their health and help them avoid all the looming issues ahead. So I start thinking to myself, what can I do for this person? How is it I can get through to them? What is it that's going to be enough to make them take action? Therein lies the problem. In most situations, there's nothing I could have done differently. When people value material objects over their health, there's no words or proof in the world that I could show them to motivate them to take action. And unfortunately, for most people, this scenario doesn't change until it's too late. The biggest and most important thing I can stress to you watching this video is this. Every single day, with every decision you make, you're either building or you're destroying your health. With every good decision, you're creating a future of health, happiness, strength, energy, vitality, and joy. In every bad decision you make, you're building a future of medication, surgery, doctor's visits, pain, heartache, and the list goes on. Now, as I said, your health is your #1 asset. How are you protecting this asset? Are you investing into your health, or are you just sitting back and squandering it? Now, if you're struggling to stay motivated, I can help you with that. Go ahead and watch this video to learn how I stay motivated. What are the common answers that you get from a doctor when you ask about all these issues or try to seek help for all the issues I just mentioned? Pharmaceuticals, 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 and more pharmaceuticals.